I think when some people watch this video, they're gonna say, Alex, somebody took out 80% of your stomach. That seems barbaric.
All of these surgeries don't come without risk. There can be risks. There can be, strictures with the bigger surgeries that you have, like gastric bypass, the duodenal switch. You have nutritional issues.
I filmed this segment in the hospital after I woke up in my room, and I said, 1 year from now, this video will either be the best decision I ever made or my biggest regret. This is the easy way out. People say that, right? Is it the easy way out?
Oh, I've heard that so many times, Alex. This is Dr. Hanna here at Las Vegas Bariatrics. I'm a bariatric surgeon. I've been doing bariatric surgery for about 24 years in Las Vegas.
A lot of people are gonna watch this video and say, Alex, this is the easy way out. People say that, right? Is it the easy way out?
Oh, I've heard that so many times, Alex. Bariatric surgery is a tool. It certainly is not the easy way out because as I teach my patients, it's a lifestyle, and it's a lifestyle that goes on forever. So individuals try weight loss in many ways. They do the diets, they exercise. Now they're doing all the weight loss medication, and they hit a wall and they just cannot lose the weight. Surgery is a tool. With that tool, you still have to have the lifestyle in place with all of the above, the diet, the physical activity, the lifestyle, all of it. So it's certainly not the easy way out.
I mean, you're saying that you have to make all these changes, but if that's the case, then why don't people just do willpower? Like you're saying you're gonna have to change your life, right? People have to do that to lose weight with us, and some people do, right? That's incredible. But
Absolutely.
why don't people just say, I'm gonna have to change my life. I might as well just change it and not get surgery.
We hear that also. And having done this over 20 years, I've seen it. And I've done the consultation where individuals come to me and we set a strategy. Okay, we need you to clean up your lifestyle, eat clean, eat healthy, stop this, stop the sodas, all of that stuff, start exercising. And they ask me that question, well, why can't I just do it myself? And some actually stop the program and they say, oh, I'm going to go and I'm going to try to do it myself. But guess what? A year, 2 years later, they're back again. They can't do it themselves. So the thing with the bariatric surgery as a tool, there is things about the surgery that actually changes you. And one is we actually making the stomach smaller, okay? So that in itself is a tool that allows you to have satiety much easier. So you're gonna eat less and you're actually gonna feel good and feel satisfied, okay? Some parts of the surgery also are metabolic. So there's metabolic changes that goes on in your body that changes the way that you process food and metabolize stuff. Insulin resistance changes. So all these things factor in and makes it easier for you to do it. But yet again, people can sabotage this surgery, okay? You still have to make the right choices. You still have to be mindful of your daily meals. If you choose the wrong meals, guess what? You can totally mess it up.
That's a great point. I guess my other question to that is how much of it is actually what you're doing, the physical versus mental?
That's a great question. How much of it that I do? And there's is no real answer to that, Alex. There's degrees of satiety, degrees of hunger satisfaction. Everybody is different. I can operate on two individuals today, and we'll have different responses to each individual as far as their satiety level. Say, we do a gastric sleeve, right? And I remove a part of the stomach. There are receptors in the stomach for ghrelin, which is the hunger hormone. And we say, we're going to decrease your hunger, your appetite, your craving, that food noise, okay? And I'll have these two patients come back, and one is telling me, Dr. Han, I'm still hungry. And the other patient comes back, oh, Dr. Han, I'm not hungry. I don't get hungry. So how do we know this? How do we gauge this? It's really hard to gauge this. But yet again, at least they're going to eat less. They're going to get full. with smaller portions. Okay. So when you say how much of this is going to be impacting the individual, the surgery itself, it impacts quite a bit, but a large part of it is the individual. Okay. A large part of it is you making the choices, making the right choices, and actually following the rules. We tell you there are rules. There are rules that you
Yeah, you
have to
gave me a
follow.
giant packet.
Yeah. So you have to still follow the rules. We tell you don't eat this, don't do that, don't drink this, don't do that, don't drink carbonation, stay away from sugar. So you still have to follow the rules. If you don't do that, you're still gonna mess it up.
I think when some people watch this video, they're gonna say, Alex, somebody took out 80% of your stomach. That seems barbaric,
Yeah.
right? Like from the outside
Oh
looking
yeah.
in, that sounds
Oh yeah.
crazy.
It is.
Why do people go to the extent of saying, yes, I want you to remove 80? Because
Yeah.
when I first heard it, I'm not gonna lie to you, it scared the crap out of
Oh yeah, that's real.
me. Yeah. Why do people still do it?
I mean, it's surgery, right?
Yeah.
Who wants surgery? I mean, geez, surgery. Once again, we tell patients also surgery is the last resort. It's the last resort. If you struggle with weight, if you have health issues, and you just cannot lose the weight, what are your other options? And that's where you draw the line and say, I have no other option. And that's why people cross over to have the surgery. Plus, all the data out there shows that surgery actually works. Surgery is the most successful way, Alex, to lose weight durably and keep it off for life. You know, when you look at medical weight loss and all the other regimens that are out there, 90 to 95% of people fail, which means they are on that yo-yo diet, exercise over and over again, weight loss, weight regain. Whereas surgery, it's a much higher success rate, anywhere from 70, 80% plus patients that do bariatric surgery actually lose the weight and they do great.
People are gonna wonder this too. And this varies by patient.
It does.
But what is like the typical weight loss that somebody sees, let's say 1 year or whatever your timeline is post
Right.
sleeve?
Average, it really depends on where you're starting. You pay when you look at the BMI, which is the body mass index, how big an individual is. So on average, most of our patients are 100 to 150 pounds overweight. And most people can lose that 80 to 100 pounds. That's average within that first 1 year. So that's typical of what we see. We have other individuals who are 400 to 500 pounds plus. They lose weight much easier and much faster. So someone in that category, they're going to be losing 200 plus pounds. Okay. And
Just
that's
to
real
yeah.
just because of
And then the
where they
rest of it
started.
is up to the yeah, for sure.
Yeah.
When I was first looking into this, I said, I tried GLP-1 first. I tried tirzepatide.
Sure.
I was on it for a year.
Okay.
Ate right through it. It didn't really.
And what happened? How much did you lose?
Well, I lost 85, 90 pounds by myself.
Right.
And then I lost about 10 to 15 pounds with
What
so
was that side?
yeah, the first one, the 80, 90 pounds was lifestyle change.
So it was you.
I stopped going to fast food. I still had a portion problem at home. But I was no longer going to McDonald's or Burger King or whatever. So that was totally me. But then I got stuck. It did help me a little bit. But when I first looked at surgery, I said, should I just wait for the GLP-1 technology to continue to get better? Because it does get better. Or do I sit here at the weight that I am and just do surgery?
Right.
And we're at this weird time where the technology is getting much
It
better.
is actually.
But, you know, what would you suggest people try a GLP-1 if they're eligible before doing the surgery? What do you see with your patients that come here? Are they
So now we've had these GLP-1s on the market for the past years, 3, 4 plus years. Okay. And as you say, the technology, the data is constantly, research is constantly getting better and better. There's single therapy, then there's double therapy, and then triple therapy. These medications are getting much more better, having much more impact. Okay. But yet again, we don't know the long-term effects of that. So yes, people can try GLP-1s, but you have to be a candidate for it. And there are side effects. So you have to know the risks versus the benefit and the possible side effects that can affect the individual. So really you have to talk to your primary doctor and really go over the risk benefits and see if you are a good eligible candidate for it. We have been seeing individuals who've been trying these medications for 1, 2+ years that are sometimes coming back to us having plateaued and are still not losing all of the weight that they want to lose. So on average, you may have the typical individual may lose 30, 40 pounds. On some individual lose a lot more, but we're seeing that plateau, and we're seeing some people, if they stop the medication, they have to continue doing it because they start to get that weight regain again.
Yeah, and that's another thing. I switched insurances
Yes,
1 year, and
and
they did
no
not
coverage.
cover it. And I was like, "Why am I at the mercy of my insurance company for future years for a
Yes,
medication is that I'm benefiting
lifeline.
from?"
Yeah,
Right.
yeah, they're pretty much gonna be taking this for life.
Yeah, this one might be a tough one to answer.
Tough. I like
Yeah,
tough.
but I want real. Okay,
I'm real.
how many of your patients regret surgery? Because
Oh boy, that's a good question.
yeah, and I want the real
Say,
answer. You
of
know?
course you do.
Yeah.
Of course, of course. I would say, I've been doing this over 20 years, Alex, and I've done easily well over 6+ thousand surgeries. And I couldn't tell you that maybe I have this small handful of patients that actually regret surgery. When you have someone that regrets it is somebody who's having a problem, someone who's having a actual side effect of that surgery, like a complication that they're dealing with now for long term. Okay. But that's rare to see. That's rare to see. All of these surgeries don't come without risk. There can be risks. There can be, strictures with with the bigger surgeries that you have, like gastric bypass, the duodenal switch. You have nutritional issues, and if someone is not taking their vitamins or being diligent on the compliance of taking their vitamins, and they have nutritional issues, that's the sort of stuff that you would see. But for the most part, these surgeries come with so much praise and much more positivity than we see than the negative sides. Most of our patients that walk through the door here that we see following up say, Dr. Anna, this is the best thing I ever did. I should have done it sooner. This is the sort of stuff that we see over and over and over again, especially people who have health problems, high blood pressure, diabetes. We have 70% of patients coming off their blood pressure medicine. You have up to 82% of people coming off their diabetes medicines. We have women with PCOS who are fertility issues. Now, a year, 2 years later, now they have a baby. I mean, it's just so amazing. I have patients who could barely walk up a flight of stairs, short of breath, now running a marathon. Okay. I have patients that have run the New York City Marathon, stuff like that, after bariatric surgery. So this is the sort of stuff that we see. Okay. So the positives are so much more than the small percentage of negative outcomes that we see.
Right now, I think I'm in the slightly regret stage,
Yeah, yeah.
but apparently this is normal.
Yes.
Mostly it's because I'm like, I haven't eaten anything other than popsicles and Jello for a while. I'm pretty positive about the situation, but they say it gets better, right?
Oh, absolutely.
Okay, so maybe ask me again in like a month.
Yeah, yeah, and you say that, and I failed to mention that part of it, but the regret is that first week.
Temporary, yeah.
It's that temporary.
When I
I
woke
was
up,
looking at the long-term regret. It's just that
no, I did
first
want the
day.
long term regret, yeah.
Yeah, yeah,
But I'll be honest, when I woke up, I was like, why the
I'm done.
frick did I
Can I
do
do
this?
this? Yeah,
And I'm not alone. I talked to my psychologist about it, and they tell you,
yeah,
like, you made a logical choice at this point. When you get into the hospital, it's mostly emotional.
that's it.
Write it out
Yeah,
and think logically what, you know.
you're in it for the long haul.
Right, right.
Yeah.
So,
Yeah, but that day right after surgery or the day of surgery, 2 days later, the nausea, and it's like, "Oh my god, what did I do?" But most the week later, they're cruising along. Now you're advancing your diet. Oh, it's so much better. Yeah, it's all good. They're never looking back again.
Thanks. I start full liquids in, I think, like a day and a half or two, so
Sweet.
I think it'll be good. I'm craving a little texture, so
That's good.
like you said, every surgery comes with its pros and cons.
Sure.
What are maybe not long-term complications, but what are some common, like, symptoms that people have to deal with and learn their body may have to learn to adapt? What I would call 1 to 3 year inconveniences that do suck, like, realistically. Because, I'm sure there's people watching this that are saying, "Wow, Dr. Hanna, amazing surgeon," which he is, but it's true, there are some like, I drink water a little too fast, and I was like, "Whoa, whoa, whoa."
Yeah.
You learn,
Oh, yeah.
but what kind of things can you expect in the learning phase of this?
There's certain early, mid, and late learning milestones that you have to get through. Like the first week is just really understanding how much you can tolerate, starting with the liquids. That's why we start you on a liquid diet first with that's clear liquids, then full liquids. You're talking just light texture, creamies, and then you have soft, mushy foods, and then you're back to regular foods. So you're talking anywhere from 1 to 8 weeks out. So you're trying to understand what it takes for you to feel satisfied. So we want you to learn satisfaction and not fullness. If you get to the point of fullness, that meant you took one bite too many and you're at the point where you're going to throw up. Okay. So that's the learning phase in the beginning.
So would you say that's, like, things that we learn when we're babies, right?
Yeah. It's
You
starting
could overeat as a
yeah,
baby, but you learn,
throw up.
but then you have that, like, as you grow, you know where your limit is. So are you essentially relearning this?
Yeah. Oh yeah. For real. And I tell some patients, most patients, I tell you that it's like being a baby again. You really are learning like you are a baby again, because all of your foods are not going to be the same as they were before. You tolerate things very differently than, say, patient number two. If you did it the same day, certain things you may like, certain things they may not like, you know? So your taste may change. Your desire for something may change. You may love salmon before surgery. After surgery, you may look at salmon and say, I really don't care for that anymore. I don't want that. And that's what we tell patients, and we teach you to have an open mind and just focus on the actual product. And we tell you, focus on your protein, focus on your vegetables. And this is why also you're followed by a dietitian. The nutritionist sees you before surgery, they see you after surgery, they guide you through this whole process, the learning process. You just learn to adjust as you try things for the first time all over again. That goes on, for months moving forward until you really can get it down. Most people would be using measuring cups, at least so you have an idea of your portion sizes, which you should be putting in. But we try to teach you to pay attention to your body, your signals. Eat slowly, take your time so that you understand that sensation of satiety and not really fullness. So you just have to understand these little baby steps and milestones as you go. So you learn as you go and you just do it the right way. And we tell you to stay away from certain things for a reason. Like we tell you, stay away from carbonated beverage,
That's a
for a
big
reason.
controversy on TikTok.
I'm sure it is.
It's huge.
And this is you may hear different things from different practices, okay? This is what we teach you here at Dr. Hanna's office in Las Vegas Bariatrics. We tell you stay away from carbonated beverages. We don't want you to be putting a carbonated beverage in this little stomach pouch now and stretch it out or blow out your staples or do something that could be really harmful to you, okay? I know patients that months later try a carbonated beverage and they come back and say, Dr. Hanna, I drank some soda and it didn't hurt me. I say, well, why'd you do that? I told you not to. You don't try something if we tell you not to because it potentially can hurt you. So why are you even trying it?
All right, Dr. Hanna. Last thing. This is a personal one, okay?
Yeah, absolutely.
I was on a bit of a diet before I went on the pre-op diet.
Right.
I really want pizza, Dr. Hanna.
You want a pizza or you want it
I
now?
want some pizza. No, I want pizza. I'm impatient.
Yeah, yeah.
When do you think I can maybe have some pizza if everything goes good?
Oh,
I'm not going to eat a lot, but I want to try some pizza.
well, you should be able to. The surgery is meant to, as a tool,
Of course.
so you can lose weight and get healthy.
Of course.
At the end of the day, once you're all healed and now you're back to your regular diet again, there's nothing wrong with having pizza. So, as I mentioned earlier in this video, the stage diet is 6 to 8 weeks to regular food. So if by 6 or 8 weeks out, you're actually eating your little real meal again, your protein, your veggies, you got a piece of chicken, fish, you're eating some vegetables, you should be able to have a pizza.
We might have to start with like chicken crust pizza or something.
Yeah. That's
That might be a little easy.
and tender, yeah. Yeah. So whatever, you start with the easier textures. So make sure you tolerate. And you're only gonna have a little bite to try it. Okay.
See how.
Make sure that it sits well with you. And that's the way to do it. I always tell my patients, look, you did surgery for a reason. You did it for health. This is a lifestyle. You want to enjoy life. You want to get out there and enjoy life. You want to be able to sit in a restaurant and order a meal. You want to be able to get on a cruise ship and have a cruise.
Buy
and eat
clothes.
food.
I want to go to the mall and I want to
Right.
buy some clothes.
Buy some clothes
Off the rack.
Off the rack.
It's a big
Yeah,
thing.
Yeah.
I want to fly a plane.
Fly a plane. Yeah.
Without
You
have
fly it.
No.
Fly in a plane. You want to fly a
Fly a plane, yeah.
Nice.
But the beginner planes,
Yeah.
they
That's
they have a weight limit.
Yeah,
I
it's
hope
big.
that I can look back on this video. I filmed this segment in the hospital
Oh, yeah.
after I woke up in my room and I said, 1 year from now, this video will either be the best decision I ever made or my biggest regret. And I have no clue what it's going to be.
I have an idea.
You could have an idea. But still, we all have.
Oh, yeah.
And so I'm excited
You
to see
have-
how this ages.
Oh, yeah, it's going to be a beautiful thing, Alex. I think it's going to be a beautiful thing. I really do.
Dr. Hanna, thank you so much.
Alex,
I'm sure that
pleasure.
we're going to
my
watch this.
pleasure. Yeah.
Really appreciate
I
it.
look forward to seeing it too. I'm going to be following you and I'm be watching it. Okay.
Should they subscribe?
Absolutely.
Yeah.
Subscribe.
Yeah.
Thank-
Follow Las
yeah,
Vegas
follow us.
Bariatrics. There you go.
Yeah.
Couldn't have had a better surgeon, so thank you.
Thank you.
Yeah.
You're so welcome.
Oh, thanks.
Glad to be here.